so. Congressman Etheridge, I want to thank you very much for showing up. There are a lot of cowardly Congress critters that are not out facing the public, and I admire you for doing so. So thank you very much, sir. One question I have might be as much for SEANC, because this is their material for city user, but you can answer it if you want. My question for them is a question for you in both parts. I see that the position that their paper takes is that we'll have lower costs for families and increased quality. Now, I'm not an economist, but last time I checked, it was awful hard to decrease costs and increase quality. So I'm not quite seeing how that adds up. And so my question for SEANC review is exactly how does this add up that we can increase coverage and decrease costs? I'm just not seeing that. But my multi-part question really is about free market solutions. It's why can't I buy a healthcare policy from a company in Idaho or South Carolina or someplace that I'd like to instead of North Carolina if I feel that they've got a better policy? And how come I can't buy an individual policy and get the same kind of tax breaks that my employer gets on the corporate purchase of insurance? They get the tax breaks and I don't. And how come I can't have a health savings account without a lot of strings attached and government regulations and restrictions on that when I would be able to save for my health care? And how come I can't join an insurance pool that's for small businesses and I can get the leverage on the insurance premiums that I might get? So, to summarize all that, there's multiple parts. Why can't we let free market solutions work instead of having government interference in the market? So why not?
I think it's a great question. We've just coming through one of the worst recessions that was precipitated by allowing the free market to work. Listen to me. We deregulated the financial systems, and you and I as taxpayers, I put a lot of money out there, and I hope we get most of it back. We're now slowly coming out. There are places in free market. I happen to believe in it. I spent 19 years in business. But an unguarded, unbridled free market system doesn't work because the average person can't stand up against it. We've seen that. Madoff is a great example. He dealt with some very smart people. Very smart people. Now, the reason that you have the current insurance regulation, and has been as long as I can remember, has been state by state. And that's why you don't buy across state lines. There is a tremendous struggle going on. Part of it was this very legislation because the insurance companies would like to keep it that way. With a broader policy overall that may not end it. But if you do it and reach across, that's how you save an awful lot of money and drive costs. At least that's what the economists will tell you. I'm not an economist. Thank you.
Microphone one. Well,